Then psoriasis. That's psoriasis. Um, so in psoriasis, we have regular acanthosis with thinning of papillary epidermis. So always, as I say, that is why we started with anatomy. Always go back and look at it. That it will help you understand that we talk about where was papillary epidermis. So when you talk of suprapapillary epidermis, it's just above the papillary epidermis. Yeah. So that there's acanthosis there with thinning of suprapapillary epidermis and dilated capillaries in the edematous papillary dermis. Remember, blood vessels are not there in the epidermis, and that is why the capillaries in that papillary dermis will be dilated in psoriasis. Then you will find also in psoriasis what we call micro abscesses. So it's called Munro, probably from somebody who first described it, Munro micro abscesses. When you talk of micro abscesses, they are not large abscesses, they are very small abscesses that you probably require to look under the microscope to be able to see them, the micro abscesses. So one of the other features of psoriasis will be micro abscesses. Then there is also it's a chronic skin disease characterized. So basically, psoriasis is a chronic skin disease characterized by well demarcated erythematous. So erythema is redness. Yeah, we talk of something erythematous is reddish. Yeah, and generally inflammation, we are talking about one of them was redness, that rubor. Was it rubor? Remember the cardinal signs of inflammation. Then there is also scaly lesions. And all of us have seen scales. If you've seen a fish, you know what scales are. So they are scaly lesion, silvery surface. So it looks silvery. That is the color. That's how it look like, silvery surface. So what happens with psoriasis is usually there is increased cell division. Yeah. So cell division in the basal layer, you remember that is where the cells start at the basal layer, and then they move up the epidermis. So cell division in the basal layer of the epidermis increases so that new cells are pushed more quickly towards the surface layers. So the cells arriving at the surface have not had time to mature into keratinized squames. So because they are occurring very fast, there's multiplication that, so the cells are being pushed. They don't have time for it to mature and become proper keratin. And that would be what would cause psoriasis. And when you look at it, mostly if you are examining the patient with psoriasis, it tends to affect the elbows, the knees, and the scalp. And actually, in the scalp is where I think it's what you'll talk of dandruff in the scalp. The scalp, what covers the head, the skin of the head, not really the skin of the head, but what covers the head. Remember, the scalp has those layers. Actually, the scalp was an acronym: skin, all those C, A, L, and P. Finally, is the pericrinium. Remember, you need to remember the in anatomy too, I think, where we talked about scalp, basically showing, and we can use those letters to show us what is there. And as we go on, the L there, for example, will be loose areolar tissue. Then there is aponeurosis, the A there, and so on. So when it affects the head, the scalp, that is the common one that we talked about, dandruff. And probably people have talked of people who have dandruff, and probably some people, even ourselves, we may have developed dandruff at some point. So basically, that is psoriasis that is affecting the scalp. So generally, the causes of psoriasis is not really known, but they tend to think of it as genetic factors. They tend to think about environmental factors. Those are the ones that are mostly implicated. But as for sure, nobody really knows the cause for sure, what exactly causes psoriasis. But genetic and environmental factors are implicated. And it's quite a common condition. So I'm sure in your practice, just like in my practice, you will always see patients with psoriasis. And they are characterized by exacerbations and periods of remission of varying duration. So what we mean by exacerbation, so you'll have situations where they worsen, they become worse, and then sometimes they heal. So there are periods of remission. So that's basically healing. And it can heal it can have remission even for years. Then comes back again. So it's not something that once you deal with it, it goes forever. So it will keep having exacerbations and periods of remissions. That is, exacerbation, they become worse, severe, and then it may even completely heal and then come back again. And some of the trigger factors that worsen the condition include things like trauma. Now, those are the things that will make the condition worse. Psoriasis, trauma, infection, exposure to sun, sunburns, and even some drugs can cause it to worsen or can trigger psoriasis to start. And sometimes it's associated with rheumatoid arthritis. And I think rheumatoid arthritis, you probably have read it. We'll be looking more at it when we come to the skeletal system, the bones and so on. We'll be able to look at rheumatoid arthritis. So it's sometimes associated with rheumatoid arthritis. Remember, arthritis refers to inflammation of the joints. So you can see there is a picture there of psoriasis. You can see that should be the elbow region. And you can see some areas of redness, erythema, and then you can see that scaly, brownish, like scaly, like covering of the surface. So that is a typical appearance of psoriasis. And then, of course, histologically, if you were to look under the microscope, when you talk of histopathology, you're looking at histology that is abnormal. That's why it's called histopathology. When you're looking at normal histology, normal microscopic anatomy, we say histology. So in this case, we're just looking at what we had said, suprapapillary thinning. So the suprapapillary become thinned. You can see those micro abscesses. So around there, you can see neutrophils. There are a lot of neutrophils, which will suggest an abscess. You can see those Munro micro abscesses. There's parakeratosis. Again, just go back and look at then the definitions of this and try to familiarize with yourself with these terminologies, parakeratosis and so on. And then you can see the red ridges, they are thickened. Yeah, and then the papilla are broadened.